hello everyone. So, we have discussed National Health Intervention Program for Mother and Child part number 1 in previous lecture, and in that lecture we have discussed about the quality services being given to mother as well as child to improve the mortality and morbidity. Now, in the part number 2 we are going to discuss about the flagship programs under the National Health Intervention Program for Mother and Child. So, let us start with the first scheme is Janani Suraksha Yojana. Yes. So, short form here is JSY. So, Janani Suraksha Yojana is a demand, promotion and conditional cash transfer. Under this scheme, the main what we are doing is providing the cash, providing some money to the pregnant mothers. Cash transfer scheme was launched in April 2005 with the objective of reducing maternal and infant mortality. Yes. So, all of these schemes will see not only this, our main objective is to reduce the morbidity, mortality in mothers and infants. It has been implemented with the objective of reducing mothers, mortality in mothers, neonates by promoting institutional delivery among poor pregnant. Yes. So, we are seeing here poor pregnant, that is why we have launched here one conditional cash transfer. Yes. So, this is first scheme. Second scheme we have is the Janani Shishu. Yes, one word here is added, Shishu Suraksha Karyakram. So, Government of India has launched this scheme on 1st of June 2011, yes, which is entitled for all of the pregnant women delivering in government institutions, government hospitals to absolutely free of cost and no expenses delivery, including the Caesarean section. Okay. Now, see the third scheme. Before the third scheme, we have some points under the second scheme here, the Janani Shishu Suraksha Karyakram JSSK, where we were discussing about the zero cost for the delivery. It stipulates free drugs, okay. Free drugs are given, diagnostics and blood and diets, okay. The food facility is given, blood facility is given. Besides free transport from home to institution, transportation facility is also provided for the under the Janani Shishu Suraksha Karyakram for mother as well as sick infants between the facility in case of referral and backdrop home. Yes. So, referral means any hospital, and from hospital to the home this facility is provided. Similar entitlements have been put in place for all sick newborns, assessing public health, government institutions for treatment at least, see what is the condition, till 30 days after birth. So, we have provided under this the facility up to 1 month after the birth. Yes, means when we are saying here as neonates. Yes. Now, in 2013, this has been expanded to sick infants, antenatal and postnatal complications as well. Yes. So, complication at the time of in the pregnancy period as well as after the delivery. Yes, postnatal complications. Now, see we have another scheme and that scheme is Pradhan Mantri Surakshit Matritva Abhiyan. Yes. Under this program we can see one poster here. This program is known as PMSMA, and this is carrying forward the vision of our Prime Minister Pradhan Mantri Surakshit Matritva Abhiyan, which was launched in 2016. Yes, to ensure quality care to the pregnant mothers and high risk pregnancy. Yes, high risk pregnancy means the comorbid mothers. Yes, when there is a anemic condition, or there is a chances of hemorrhage. Yes, at the time these are called as a high risk pregnancy, and detection of these high risk pregnancy in pregnant mother on 9th of every month. Yes. So, this is one condition we have, put here 9th of every month will detect the pregnant mothers. If there is a high risk pregnancy, then manage it at the early stages, so to reduce the mortality. There is a one scheme, LaQshv. Yes. In order to further accelerate the decline in the maternal mortality ratio, which I have already discussed in the previous lecture. So, the data which we have in the India for now, we have the maternal mortality ratio of 130, okay, means 130 maternal deaths per 1 lakh of live births. So, we want to decline the maternal mortality ratio up to 100, and now we are on 130. So, in the coming years, the Ministry of Family Health Welfare has recently launched 2018 to 19 LaQshv program. Yes, and this LaQshv scheme or the program means the Labour Room Quality Improvement Initiative. Yes, this LA means here is the Labour Room Q Quality Improvement Initiative. Yes, so it is taken from this whole. Now, LaQshv program is focused and targeted approach which is strengthening the labour room. So, the facilities provided at the labour room. So, labour room and maternity operational theatres which aims at improving quality of care around the birth and ensuring respectful or dignified maternity care to mothers. Now, see what are the objectives. There is a one chart we can see. 3 objectives, it is divided into 3 objectives. First objective is to reduce maternal and newborn mortality and morbidity. So, this is first objective of LaQshv scheme. Second objective, to improve quality of care during the delivery and immediate postpartum care. Yes, so we are talking about the emergencies. Postpartum care after the delivery. Yes, sometimes after the there is a situation of miscarriage also. So, sometimes we need the immediate treatment or immediate therapy after the postpartum as well. Yes, after the miscarriage as well. Stabilization of complications. Yes. So, the complications associated in between of pregnancy as well as later of the pregnancy or delivery at the time after the delivery, and ensure timely referrals. Okay. And these referrals, timely referrals means from sub-center to the primary health care centers, or from primary to the secondary, or from secondary to the tertiary as it is required. Okay. It is conditional from situation to situation, and enable an effective two-way follow-up system. Why we are saying two-way follow-up system? Means means the pregnant mothers, they are communicating with the institution, or they are communicating with the hospital healthcare systems. At the same time, the institutions or healthcare systems will also communicate to the to pregnant mothers or to the child or newborn, or to the neonates, infants, etc. Yes. So, this should be the two-way follow-up system. Okay. So, there should be a proper follow-up from both of the sections. Now, see the third objective, to enhance the satisfaction of beneficiaries. Yes. So, how we can enhance the satisfaction? If we are providing the quality care, of course, the satisfaction will be enhanced. Yes. And who is the beneficiary here? Who will be satisfied? Of course, the mothers. Yes. A beneficiary is visiting the health facilities and provide respectful maternity care. Okay. The quality care, the dignified delivery, the respectful delivery to all the pregnant women attending the public health facility. So, this is for the government hospitals. Yes. So, these are 3 objectives here. First, we have discussed, yes, we are reducing mortality, morbidity. Second, we are improving the quality of care, and third, we are providing the satisfaction to the beneficiaries. Now, coming to the other programs, here is the comprehensive abortion care services. Okay. So, the previous slide I was discussing about the postpartum complications. Yes. So, under the postpartum complication there is one situation also arises, the abortion. Yes. So, comprehensive abortion care services under this, this is provided by the public health facilities, and this care is provided for all of the days, okay, for all of the timings 24/7, primary health care centers, first referral units, and district health centers, then sub-district health centers, community health centers, they are including the delivery points. Yes. Now, supply of niche pregnancy detection kits. These are the kits available at the health centers, and by these kits it is very easy to identify the pregnancy. Yes. So, they are available at sub centers for early detection of pregnancy is undertaken, and if it is of course if it is known, yes, there is a pregnancy, of course the condition or the situation which will be there after the pregnancy, it can be handled at early stages. Yes. So, the capacity building of medical officers is being carried out routinely in safe MTP techniques. Yes. Safe MTP techniques is required. MTP means medical termination of pregnancy, okay, and there are some rules when the pregnancy can be terminated, at what the conditions, okay. So, that should be safe, and they are done by the only by the doctors. Yes. Now, see, comprehensive abortion care services under in the continuation we have some other points associated with it, like ANMs, ASHA workers, auxiliary nursing midwives, and accredited social health activists. Yes, they are the health professionals, basically they are working at the fundamental or basic ground level, and other field functionaries are trained to provide confidential counseling. Okay. Counseling is required to mothers for themselves as well as for their babies, okay, about nutrition, about how to handle the period. Yes. So, they are providing the confidential counseling for MTP and promote post abortion care. So, medical termination of pregnancy and promoting the post abortion care, including adoption of contraception. Yes. So, they could be of many types, okay, physical methods, it could be counseled to the people about the physical methods, then there are some chemical methods, okay, there are some permanent methods as well as for contraception. So, these methods should be counseled to the eligible couples especially. Yes. Routine orientation and training of ASHAs to equip them with skills to create awareness on abortion issues in the community and facilitation of women access to these services. Yes. So, this is the main thing the ASHA workers are doing. The ASHA workers or the ANMs, they are providing the counseling basically, yes, to the eligible couples or to the women's about the termination of pregnancy and about the postpartum complications, how to handle it, and about the contraception. Yes. Now, see, regular monitoring and evaluation of services. Yes. So, monitoring is required and evaluation of it by some of the tracking system is required. So, provision of RTI and STI services. Yes. Under the National Health Intervention Program for Mother and Child, sometimes we have seen sexually transmitted diseases, yes, like HIV. Yes. So, this is transferable from mother to child. We will get to know at the early stages before the delivery, we can treat it. We will provide the care to the child so that it will not transfer to the newborn. Yes. So, this is the provision of RTI or STI services. Yes. Under the National Health Mission, provision of STI and RTI care services is a very important part. Yes. Very important strategy to prevent HIV transmission and to promote sexual and reproductive health services. in all of the FRUs, first referral units, all of the community health centers, all of the primary health care centers, and they all are working for all of the timings. Yes. Now, there is one scheme we are, or one program we are providing to the rural areas. So, we have one day, that day is the Village Health and Nutrition Day, and this day, the short form here is a VHNDs, are being organized at Anganwadi Center. Yes, and these Anganwadi centers are the local centers, we can say. In the rural areas, they are providing the healthcare facilities, or they are providing the counseling to the mother and for the care of their child. Yes, and this day, Village Health and Nutrition Day, is held at least once in every month. Yes, it is one of the platform to provide antenatal and postpartum care for pregnant mother, and they are promoting the institutional delivery. Yes. So, healthcare professionals, skilled healthcare professionals are performing the institutional delivery to reduce the infections which are associated at the time of delivery. They are providing the immunization. What type of immunization is important here is the tetanus. Okay, tetanus injection. There is a one formulation we provided TD, tetanus and diphtheria. Then they are also providing about the family planning. So, what is family planning here? Means about the spacing methods between two childs. Yes. Then nutritional facilities also, nutrition which is to be provided to child, at what age they will be required for the food, they have to take the food, or means how to manage the newborns. Yes, newborns or the infants. Then there are some contraception methods. So, these are all under the family planning and nutritional counseling. So, I have covered this. Now, see infrastructure. Yes. So, under the infrastructure, there should be a delivery point from where the care is given. Yes. So, all of the states and union territories have identified delivery points with certain minimum benchmark of performance in order to prioritize and direct resources in focused manner to these facilities. Yes, all the delivery points should be strengthened with, and how these delivery points are working, we have infrastructure, but what we required? We require the manpower. Yes, so they should be strengthened with trained and skilled human resources. So, doctors, nurses, lady health visitors, ANMs, ASHA workers. Infrastructure, equipment, drugs. Yes, equipment should be there. Equipments means for the early detection of pregnancy, there should be some kits, pregnancy kits, okay, which are identifying the early pregnancy. And then also we should have some other test facilities like blood test facility, very common facility, and also ultrasound facilities. Yes, drugs. Yes. So, very common drug we are prescribing to the pregnant women is the IFA, iron, folic acid, tablets, calcium, means nutrition. Okay. So, some nutrition we are providing, and supplies, referral, transport, etc. Referral, transport, etc. means there should be a transportation facility like ambulance. Yes, it should be there for providing the transportation from one referral unit to the another referral unit. Okay, from PSC to the CHC, CSC to the tertiary healthcare centers, for providing quality and comprehensive care for reproductive, maternal, child, maternal, newborn, child healthcare plus adolescent. Okay, so under this, from these delivery points, these are some these you can say these are the facility units where the pregnant women will approach. Yes, and these delivery points should be equipped with all of these facilities. Yes, these skilled workers, equipments, drugs, supplies, referral, transportation, etc. Now, under the infrastructure, we have obstructive HDU or ICU. Yes, so obstetric HDU and ICU means, HDU means high dependency unit and ICU is intensive care unit. Okay. This is required in some of the complications. So, operationalization of obstetric ICU or HDU. In a high case load, tertiary care facilities is being conducted across the country for complicated pregnancy. Sometimes there is a care which is required for the newborn. Okay. So, for that we require the ICU or high dependency unit, as well as for the mothers also. Okay. It can be required for mothers in a high complications. Then there should be MCH wings. MCH wings means maternal child health care wings. Yes. So, the state of the art maternal and child health wings have been sanctioned at district hospitals. So, these wings we can see in the district hospitals or district women hospitals, and other high case load facilities at sub-district level. As integral facilities, they are integrating the facilities, yes. So, they are working as a integral facilities for providing the quality obstetric complications or the neonatal care. Now, see information system for maternal health. Okay. From where we get to know the information. So, there should be some tracking system or there should be some surveillance system. There is a first maternal death surveillance and response, which is known as MDSR. Yes. So, under this surveillance, what we are doing, the process of maternal health review. Okay. We are reviewing the maternal deaths. Has been implemented and institutionalized by all states, and all of the states are working for this data. Yes, they are taking this data since 2017. Guidelines and tools for conducting community based MDSR maternal death surveillance review or response and facility based MDSR has been provided to the states. Yes, and this is collected, summarized if we will see the whole of the data for India. So, the states are reporting deaths along with the analysis for the causes of death. Not only we are taking the data, means numbers, how many deaths are occurring in mothers or the child or the newborn, we are getting the causes as well, what are the reasons associated with it, so that we can work for further. Now, see another information, means there is some another portal we have, the RCH, yes, or MCTS Portal. So, name based tracking system, this is one of the tracking system, mother and child tracking system or reproductive child healthcare portal. Yes. So, this is portal which is initiated by Government of India, and our main goal for this portal is as a policy decision to track every pregnant women, okay, infants and child up to 5 years of age. By name of the provision timely ANC, and what are the data collected. So, I am just giving a short brief here. We are taking how many mothers are getting the timely ANC, yes, and the percentage here is. So, timely ANC means antenatal care, how many mothers are getting the at least 4 health visits, okay, or proper care they are getting. So, this is under timely ANC. How many are getting the institutional delivery, yes, and how many are getting the PNC, means postnatal care after the delivery, along with immunization, how many are getting immunization, tetanus and TD, yes, tetanus, diphtheria and other related services, means sometimes blood bank facility, transportation facility. So, they are under the other related services, yes. So, this is under your RCH portal. You will see the RCH portal or MCTS portal, we will get to know about all of this information. Okay, so, we are tracking all of the pregnant women here. Now, see MCP card, there is a one card we can see on the slide here, mother and child protection card. Okay. In this card, information regarding the pregnant mother is written here. Okay. So, see Ministry of Health and Family Welfare and Ministry of Women and Child Development. Yes, they have been launched a tool, and this tool is for documenting and monitoring the services. Yes. So, every time when the mother will come, she will come with this card. Okay. So, all of the information, the previous information, okay, regarding the pregnancy or after of the delivery, everything is written. So, we can monitor it very easily. It is one of the documentation tool. Yes, tool for documenting and monitoring the services for antenatal, intranatal. Okay, the duration between this pregnancy, intranatal means antenatal and postnatal. Period between antenatal and postnatal is called as the intranatal period. Okay. So, the start of the pregnancy or to the delivery of the baby. Yes. So, all of the information is written here and we can easily monitor the pregnant mother, the immunization status. Yes, and the growth monitoring of the infants. So, information regarding the infants is also written in this. Yes. So, this is known as MCP card. Thank you so much everyone. I hope this is clear to all of you about the National Health Intervention Program for Mother and Child. We will meet in the next session.